Welcome back, everyone, to another deep dive. I am so excited to have with us an expert in pharmacology who can help us explore a really fascinating and, frankly, essential class of drugs for any nurse to understand. And I know this is going to be really helpful for you specifically as you work with a more mature adult population. Today, we are diving deep into the world of adrenergic-blocking drugs, alpha and beta blockers, getting into how they work, what they're used for, what to watch out for, and of course, how this all comes together when you're at the bedside caring for your patients.
It's great to be here, ready to dive in.
So to kick things off, let's start with a quick review of something I know you already know, but it's important to set the stage that there's a sympathetic nervous system, or the fight or flight response. What's happening at a basic level when that system kicks in?
Well, when you encounter a stressful situation, your heart starts racing, your breathing quickens, your pupils dilate, and that is all thanks to your sympathetic nervous system.
Oh yeah, for sure. I
Yeah.
can definitely relate to that feeling.
It's releasing neurotransmitters like norepinephrine and epinephrine. And these neurotransmitters bind to receptors throughout the body. And, it's our body's way of preparing us to deal with a threat.
So that's where these adrenergic blocking drugs come in, right? They kind of step in and modulate that response.
They do. They act as what we call antagonists, meaning they bind to those same receptors, but they block the neurotransmitters from actually having their full effect.
Interesting. So it's almost like they're putting a key in a lock, but not turning it, so to speak.
A great analogy.
So we've got these two main types, alpha blockers and beta blockers. Let's start by unpacking alpha blockers. What are they all about?
Alpha blockers target alpha receptors, specifically the alpha-1 subtype. And these receptors are found all over the body, and they play a key role in vasoconstriction. So by blocking these receptors, alpha blockers relax the blood vessels, which leads to vasodilation.
Ah, so that widening of the blood vessels helps lower blood pressure, which is why they're often used to treat hypertension, right?
Exactly. They reduce what we call peripheral resistance, so there's less pressure against blood flow. This helps ease the strain on the heart and ultimately helps lower blood pressure.
Now, I know alpha blockers aren't just for hypertension. What about their use in treating benign prostatic hyperplasia, or BPSH? I'd love to hear more about that.
BPH, as you know, it's a common condition as men get older where the prostate gland enlarges, and it can actually obstruct urine flow. Alpha blockers help relax the smooth muscle in the prostate and bladder neck, and this eases that constriction and makes it easier to urinate.
Okay, now there's one specific alpha blocker that I came across in my research. I wanted to get your take on it. It's tamsulosin, which I think is often marketed as Flomax.
Yes, Flomax, very common.
Now, it's commonly prescribed for BPH, but I also read about its potential off-label use in managing kidney stones, particularly in women. Have you come across that in your practice?
I have. While it's not FDA approved for that use, there is research that suggests it can help facilitate the passage of kidney stones. So it's based on clinical observation and research, and it can definitely be a valuable tool in those situations.
That's really fascinating and definitely relevant to our listeners who are working with patients in this age group. Now, of course, like all medications, alpha blockers have potential side effects. What are some things that nurses should be particularly aware of?
One of the biggest ones is a sudden drop in blood pressure, especially with that first dose. We call it the first dose phenomenon, and patients might feel dizzy or lightheaded, even faint. That's why we often tell patients to take that initial dose at bedtime.
That's really important advice, especially considering this patient population is already at a higher risk for falls.
Exactly. And along those lines, we also need to be mindful of orthostatic hypotension.
Which is that dizziness when standing up too quickly.
Right. Right. It's because those blood vessels, now relaxed from the medication, don't constrict quickly enough when you stand. So we always want to educate patients on rising slowly from sitting or lying down and staying hydrated.
All right, so first dose phenomenon, orthostatic hypotension. What about more general things like headaches or dizziness?
Yeah, those are actually quite common as well. You might also see fatigue, nasal congestion. Every patient responds differently to medications. So really, it's about individualizing that care and monitoring their response.
Absolutely. Okay, so we've talked about how the sympathetic nervous system can really get things going, but there are also medications that kind of help slow things down, specifically beta blockers. So how do those work? What's their mechanism of action?
So beta blockers are different in that they primarily affect the heart and the lungs. They work by blocking the effects of epinephrine and norepinephrine, but at the beta receptors.
Okay, so it's like alpha blockers are working on the blood vessels and beta blockers are working more directly on the heart.
That's a great way to think about it. By blocking those stimulating effects, they lower the heart rate, reduce the force of contractions, and slow down the conduction of those electrical signals through the heart.
Interesting. So essentially, it's reducing the workload on the heart.
Exactly, which ultimately reduces the heart's demand for oxygen.
I'm already starting to see why these are so valuable for things like angina, hypertension, and even heart failure.
They really are, and it's important to note that there are two main types of beta blockers, cardioselective and non-selective.
Right, so cardioselective primarily target those beta-1 receptors in the heart, while non-selective block both beta-1 and beta-2.
Exactly, and that's a key distinction because beta-2 receptors are not only found in the heart, but they're in other organs like the lungs.
So the choice between those two really depends on the patient and what you're trying to treat.
Precisely. We need to look at their other medical conditions, potential side effects, even their lifestyle. There are a lot of individual factors that go into making that decision.
And that's where our nursing judgment and critical thinking skills really come in, right?
Yeah.
We're the ones assessing, educating, and advocating for our patients to make sure they're getting the best and safest care possible.
I completely agree. We play such a critical role in ensuring safe and effective medication management. It can't be emphasized enough. Welcome back. It's great to continue this deep dive, especially as we focus on practical applications for a seasoned nurse like yourself.
That sounds perfect. It's one thing to understand these mechanisms, but how does this all connect to real-world use? We were just talking about how beta blockers affect both the heart and the lungs. So how does that actually play out when we're treating specific conditions?
Well, let's take angina pectoris, for example.
Okay, yeah, the classic chest pain.
Right, often caused by reduced blood flow to the heart muscle. Beta blockers help here because they're slowing the heart rate, reducing the force of contractions, and ultimately lessening the heart's workload and oxygen demand.
So it's almost like taking your foot off the gas a little bit, giving the heart a chance to work a little more efficiently.
It is, and this same principle applies when using beta blockers for hypertension.
Oh, right, because by decreasing the heart's output, you're contributing to lowering blood pressure.
Exactly, which is why they're such a cornerstone of managing hypertension.
I also remember from my cardiology studies that beta blockers are used in managing certain heart arrhythmias. Can you remind me how that works?
Sure, they can help control those irregular rhythms by slowing the conduction of electrical impulses through the heart. Think about conditions like atrial fibrillation or supraventricular tachycardia where the heart's beating too fast. Slowing those electrical circuits can help restore a normal rhythm.
That's pretty incredible. So these medications can fine-tune the heart's activity in such precise ways. And that makes me think about another area where beta blockers have been shown to be beneficial, and that's in treating heart failure, which always seemed a bit counterintuitive to me.
I can see why you'd say that. I mean, you would think a weakened heart needs more stimulation, not less. But over the long term, beta blockers actually help that heart remodel itself. They reduce the workload, they prevent too much stimulation by those fight or flight hormones. It's like giving it a chance to catch its breath and get stronger.
Wow, that's a great way to explain it. Okay, so shifting gears back to alpha blockers. I know we touched on their use in hypertension, but can you go a little deeper into how they're used to treat BPH?
Sure. As you know, with BPH, the prostate gland enlarges, and this can constrict the urethra and make it difficult to urinate. Alpha blockers come in because they relax the smooth muscle in the prostate and the bladder neck, so they're easing that constriction and helping improve urine output.
Right, so they're helping men regain control of their urinary function, which is so important for their quality of life. It's amazing how these medications can address such different conditions by targeting those specific receptors.
It really does come down to understanding those mechanisms and how they play out in different situations.
Now, you've mentioned a few times that these medications are not one size fits all. So how does that play out when you're choosing between the different types of alpha and beta blockers?
Well, choosing a specific drug isn't always a straightforward process. We have to consider a lot of things: the patient's characteristics, other medical conditions, possible side effects. Even their lifestyle can make a difference.
So it's not just about choosing the right drug class, but it's about picking the best drug within that class for that individual.
Exactly. For example, with beta blockers, remember we have cardioselective and non-selective. If someone has asthma, a non-selective beta blocker, which affects both the heart and the lungs, could make their breathing worse.
That's a really important reminder. We have to look at the whole picture and think about any potential contraindications.
You got it. Weighing the risks and benefits for each person, taking into account their overall health. And that's where our nursing knowledge and skills are so vital. We're assessing, we're monitoring, we're educating, and we're advocating for our patients.
And that's what really makes a difference in their care. Now, before we move on to actually applying this knowledge, I want to circle back to something you mentioned earlier, lifelong learning. You spoke about it with such passion. It really resonates with me, especially because I'm always trying to learn new things. Why is lifelong learning so important in a field like pharmacology?
Well, it's really the heart of nursing. This profession is always changing. There are always new discoveries, technologies, treatments, and we have to keep up. In pharmacology, there's always something new, a new drug, updated guidelines, interactions to watch out for.
So we're always on this journey of learning, refining our skills. I find myself reading research articles, going to conferences, even listening to podcasts like this one to stay up to date.
That's fantastic. We're lucky to have so much information available. But it's more than just staying updated. It's also about having that mindset of always questioning, exploring, wanting to understand more.
And that curiosity ultimately helps us be better clinicians and provide the best care for our patients. Speaking of applying knowledge and really honing those clinical reasoning skills, are you ready to tackle some critical thinking exercises related to these adrenergic blocking drugs?
I'm always up for a challenge.
Perfect. I've got a couple of scenarios pulled from questions our listeners have sent in. These are designed to put our knowledge to the test. So here's the first one. It involves a patient you might see in your practice. A 68-year-old woman with a history of hypertension and mild asthma is prescribed propranolol, which I think is also known as Indrol, to manage her rapid heart rate. During the teaching session, she expresses some concern and she says, "I've heard beta blockers can cause breathing problems. Will this medication make my asthma worse?" How would you approach this situation?
That's a great question and a really common concern. I would start by acknowledging her concern and explaining that propranolol is a non-selective beta blocker, meaning it can affect both the heart and lungs. I'd also make sure to explain that while beta blockers can sometimes trigger bronchospasm, the risk is generally lower with cardioselective beta blockers.
So that makes sense. Validating her concern, but also educating her about the different types of beta blockers. Would you consider recommending a switch to a cardioselective beta blocker to minimize that risk of making her asthma worse?
That's definitely a conversation to have with her doctor. Considering her asthma, a cardioselective beta blocker like metoprolol or atenolol might be a safer option for her.
Right, and that's a perfect example of how our understanding of these medications can guide those clinical decisions or really advocate for our patients' well-being. Okay, so let's move on to scenario number 2. This one involves a patient that you might encounter in a hospital setting. A 75-year-old man with a history of BPH is admitted for a hip fracture. He's prescribed doxazosin, or Cardura, to manage his BPH. So given his age, his recent injury, and this medication, what are some key nursing considerations that come to mind?
This is a great example of where a lot of different factors come into play. We need to consider his age. Older adults tend to be more sensitive to medications. They might experience more side effects. And on top of that, he has a hip fracture. So we need to think about things like mobility limitations and pain, which could increase his risk of falls. And of course, alpha blockers can cause that orthostatic hypotension, which adds yet another layer to that risk.
So we had to be really careful with him. What are some specific interventions that you would prioritize in this case?
Well, assessment is key. We need to get those baseline vitals, blood pressure, heart rate, before giving him the doxazosin. And we can't forget about his pain. Pain meds can interact with alpha blockers, making side effects like dizziness worse.
Oh, good point. So we're thinking about potential drug interactions as well. What else comes to mind?
Because his risk of falling is higher, we need to really focus on fall prevention, keeping his bed low, using bed alarms if needed, and assisting him when he walks. We also need to educate him and his family about orthostatic hypotension. He needs to understand how to change positions slowly and call for help when getting out of bed or a chair.
So it sounds like we're really taking that holistic approach, looking at his age, his injury, the medication, and his overall safety.
It really is about understanding how all of these pieces fit together and adjusting our care accordingly.
This has been so insightful. It's amazing to see how what can seem like theoretical knowledge actually translates into tangible actions at the bedside.
It's all about connecting those dots. And the more dots we connect, the better prepared we are to provide that safe, effective, and compassionate care.
Before we wrap up this section, I have one more question that's been on my mind. We've talked a lot about potential side effects of alpha and beta blockers, especially in older adults. So what are some strategies we can use to minimize those risks and also help improve medication adherence?
That's a great question and a really important one. We want these medications to be helpful and not cause unnecessary harm.
Absolutely. It's all about striking that balance. So what are some of your go-to strategies for achieving that?
I always start with patient education. We have to empower patients to understand their medications, potential side effects, warning signs, when to call the doctor.
Right, using clear language they can understand, avoiding medical jargon, maybe even providing written materials they can refer back to.
Exactly. And we should always tailor those instructions, taking into account things like their cognitive abilities, how well they can read, their preferred language, all of that matters.
And what about adjusting doses? Would you consider starting with a lower dose and increasing it slowly to minimize side effects?
Oh, definitely. Starting low and going slow is especially important with older adults. It gives the body time to get used to the medication.
And even something as simple as when they take their medication can make a difference, like taking that first dose of an alpha blocker at bedtime to avoid that initial blood pressure drop.
That's a great example. Strategic timing can really play a role.
So we're talking about education, dosage adjustments, timing, and of course, ongoing monitoring. All of that working together to keep people safe and make sure their medications are as effective as possible.
That's a great summary. And, we can't forget the importance of communication. We need to be talking with the healthcare team, with doctors, pharmacists, other nurses to make sure we have a complete plan for each person.
These are all such valuable insights, especially for a nurse like our listener who's working with this population. It's about individualizing that care and thinking about the unique needs of these patients.
Absolutely. And as we've said before, lifelong learning is key. We need to stay informed about the latest research guidelines to make sure we're giving the most up-to-date care.
This has been such an insightful discussion. We've covered so much from those mechanisms of action to those specific indications, the side effects, nursing considerations, even touched on the importance of lifelong learning.
I agree. It's been a pleasure sharing some of my knowledge. Welcome back to our deep dive. It's been wonderful exploring these medications and really focusing on how this knowledge applies to your work with mature adults.
It's been such a great conversation. And as we wrap things up, I'd like to shift our focus from the what of these drugs to the how, specifically how we as nurses can use all of this information to give the best care possible.
I love that. We've talked about the science. Now let's talk about the art of nursing.
Throughout this deep dive, we've talked a lot about patient-centered care. So I want to ask a question that gets to your experience with this specific population. How do you think the age of your patients, many of whom are over 50, influences how you teach them about alpha and beta blockers?
That's a really important question. We absolutely have to be aware of the unique needs and challenges that our aging population faces when it comes to medications.
So can you talk a little bit more about those challenges and how we can change our teaching strategies?
Of course. First, we have to remember the body changes as we age. How the body absorbs, metabolizes, and gets rid of drugs, it can all change. That can change how a medication works and increase the risk of side effects.
So medication that worked well before might need to be adjusted as a person gets older.
Exactly. And then there's polypharmacy, which is really common in older adults who are often taking multiple medications for different conditions.
Right, that's where those drug interactions can become a real concern.
Exactly. So medication reconciliation is so important. Now, when it comes to actually teaching older adults about their medications, we often need to simplify things, breaking down information into smaller pieces.
So keeping it concise and avoiding that medical jargon.
Right. And it's always a good idea to check that they understand. Ask them questions, see if they have any concerns.
Would visual aids or written materials be helpful? I imagine they could be good reinforcement.
Absolutely.
Right.
Large print materials they can reference are great. Pictures, diagrams, even videos can be really helpful, especially for people who struggle to process verbal information.
What about including family members or caregivers in the education process?
Oh, that's a fantastic idea, especially if someone has memory problems or trouble managing their medications on their own. It provides a support system and makes sure the information sticks.
These are all fantastic tips for tailoring our education to the needs of this population.
It's all about meeting patients where they are.
It seems like we've come full circle. We started by talking about your passion for lifelong learning, and now we're ending with this reminder that part of that journey is adapting to the changing needs of our patients.
I couldn't agree more. Knowledge plus compassion, that's what defines great nursing care.
To our listener, thank you so much for joining us on this deep dive. We hope you found it helpful and informative.
Remember, every interaction is a chance to learn, both for us and our patients. Keep those minds engaged, those hearts compassionate, and never stop learning.